As we told you about a little earlier, Florida Governor Ron DeSantis allowing gyms to reopen in the state on Monday. He's also easing restrictions in restaurants and retail shops. And Georgia long ago began its reopening process.
All right, Dr. Christie Alexander with FSU's College of Medicine joining us again today live to answer more of our questions. Dr. Alexander, thanks for being here. And I got to say, during our mic checks, you said you were outside the FSU primary health clinic in between seeing patients. So we sure do appreciate your time.
Absolutely. Thank you for having me again.
A true Wonder Woman. All right, as thousands of Floridians prepare to work out again at gyms across the state, we want to know, should people take extra precautions if they plan to go back to the gym, and what should those precautions actually be?
Absolutely should take extra precautions. I would actually call your gym to find out what kind of things that they're doing to set up for safety around this. You know, hopefully they're only letting so many people in at a time, wiping equipment down in between uses, every single use, not just in between like an hour at a time, but every single use. Having people wear masks while they're working out would be a really good idea. In addition to the business owners themselves wearing the masks, everybody maintaining that 6 feet of social distance while they're there. And then just assess your personal, are you comfortable going in where people are around you, breathing heavily, potentially coughing, that kind of thing. So a little bit of personal responsibility plus the responsibility of the business owner to keep everybody safe.
What are some, I guess, signs or signals that you and other doctors will be watching for to determine whether easing the restrictions is safe or if the virus is starting to spread again?
We're really just going to be watching the numbers of cases that we're seeing, both, you know, the tests that we're doing, how many positive cases there are both in Florida and nationally, looking at our Florida Department of Health site, looking at the CDC site, just monitoring the numbers. And it's going to take a little bit of time. Everything just started opening up. So if somebody develops symptoms, it takes 3 to 5 days. It takes about 7 to 10 days to get the test back. So you're looking at a 2-week time period for those getting tested that might be symptomatic before you even see what the numbers are doing. So that's why I think all the predictions are early June, because that's right around the time when those 2-week factors will start to pick up, and we'll see where we stand at that time.
And just yesterday, the CDC issued a new advisory on what's called MultiSystem inflammatory syndrome in children. What can you tell us about that?
So this is a sort of new sort of a basket diagnosis of all these symptoms that we're seeing in children that are infected with coronavirus. It's a major inflammatory response that hits the entire body. So rashes, kidney dysfunction, heart dysfunction, lung dysfunction. It kind of hits everything, which is why it's named as such. We thought at first we were just seeing Kawasaki's disease or a variant of that, but Kawasaki's disease is more specific with the areas that it hits. Like it hits the coronary arteries, whereas multisystem inflammatory syndrome affects the entire heart. So it is extremely dangerous and it needs to be looked at right away. We don't know why certain kids get it and why certain kids don't, but if you have a child that's had a fever for more than 24 hours, abdominal pain, nausea, diarrhea, complaining of severe fatigue, just not looking right, take them immediately to the doctor or at least call your doctor for more information. And this is anyone up to the age of 21. Wow. So 21 and younger is where we're seeing it, and just making sure that they're getting looked at as soon as possible if they develop those symptoms.
Okay, good advice there. This question is from a viewer. Since we're self-isolating to protect from COVID-19, we're being exposed to fewer everyday germs. Will this make us more susceptible to colds and other viruses or infections when we come out of isolation?
You know, that's a really great question because it's kind of hard to know. Now, one thing we do know, when you think about NASA astronauts that are away for 6 months, 12 months, and they come back, they don't get sick because they haven't been exposed to germs. They get sick because they've been isolated in general, and that affects your immune system, both the mental isolation and the physical isolation. Now, they have the effect of gravity and all those other things that play into that, but we are seeing some real effects from the isolation itself. So it's very, very important that while we are physically distancing, we maintain our social connectedness illness, whether that's a phone call to a friend or FaceTiming somebody or something like that, that's extremely important to our immune systems, actually. And then in addition, everything we talked about, a few days ago about building our immune systems in terms of eating healthy fruits and vegetables, getting enough sleep. If you're a smoker, trying to cut back, not drinking as much alcohol, exercising as you can. And I know we talked about the gyms, but that could be as much as just walking around the block a few times with the mask on, getting that physical activity as much as possible. Just keeping yourself healthy, mentally and physically, is even more important than the exposure to germs themselves.
All right, all great advice there. We want to talk about people that have recovered now. Do we know anything about immunity, whether they're developing an immunity, and if so, how long that period of immunity might last?
We still aren't completely sure. We're seeing that some people have certain antibodies. We're now seeing that some people have a certain amount of T cells that fight viruses, maybe from being exposed to the common cold before or another form of a virus earlier, that those T cells are already built up in your system and might confer some immunity. But the jury is still out. There's just a lot we don't know about it, and everybody's jumping on the bandwagon to find out as much as possible. Hopefully, this data is true. And if we have those elevated T cells in our bodies or those elevated antibodies in our bodies, they will confer some sense of immunity and keep us healthier. We just don't have enough data yet to be sure.
We said earlier in the newscast, the president says they're working at, quote, warp speed to find a vaccine for coronavirus. We ask you this question, it seems, at least once a week. So
yeah.
We don't want to break habit. Want to ask you again this week. Anything new on a vaccine or treatments to fight this?
Nothing more than what you heard and nothing more than what I said the last time. We're seeing some data saying we might have a vaccine out in September, and if it does come out, we may not have it in appropriate quantities to hit everybody nationally or to help everybody that way right away. But if it is by December, that is something we've been talking about since this began, that it might take 12 to 18 months to develop a vaccine, which would be right around December. So hopefully that does come true, because that will be our best efforts to protect and to get us back to whatever the new normal might be.
And we appreciate your patience with us asking this question, because we're probably going to have to ask it again next week. It just seems to be everybody crossing their fingers that as we learn more, something comes down the pike.
All right, Dr. Alexander, as always, is there anything else
Absolutely.
you want to add before you go today?
Just everybody stay safe out there, and again, that social connectedness is really important. I know we've been away from each other for a really long time, and we're very tempted to get out and get back out to those open areas and get back to the public places that are reopening. Just think about your own personal risk and how much you're willing to risk your own personal health before you make those decisions. And when you go out, I'm going to say it again, socially distance, wear your mask, and make sure you're washing your hands before and after and even during wherever you are.
Always worth a reminder there. Dr. Alexander, thanks so much. We appreciate you.
Yeah, and please thank your patience for us, too, letting us borrow you for 10 minutes on this Friday. All right. Doctor, thanks. And as always, you can rewatch this interview and all of our previous ones with Dr. Alexander. We have to be at least at 10 now, I would think, over the last
I'm sure.
couple
More
of
than
months,
that,
right? Okay.
for sure.
Check those out online at WCTV.tv. Always some great information. We'll be right back.